The liver plays a critical role in detoxification, nutrient metabolism, and energy storage in the body. However, poor dietary habits and an unhealthy lifestyle have led to an increase in liver-related diseases. Among the many nutrients that support liver health, omega-3 fatty acids have shown significant positive effects. But how exactly does omega-3 affect the liver? This article will provide detailed information about the role of omega-3 in liver health and the best ways to incorporate it into your diet. Omega-3 is indeed beneficial for liver health. Scientific studies have demonstrated that omega-3 supports liver function through various mechanisms, offering substantial benefits. It has anti-inflammatory properties, primarily through two key forms of omega-3, EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. These compounds play a significant role in reducing chronic inflammation, which is often a contributing factor in liver diseases like hepatitis. Research has also shown that omega-3 can reduce CRP, C-reactive protein, levels, a marker of inflammation in the body, further protecting liver cells from damage. This confirms that omega-3 is not only good for the liver, but also helps lower the risk of severe complications, such as cirrhosis. Omega-3 also plays an essential role in managing non-alcoholic fatty liver disease, NEFLD, a condition where excess fat accumulates in the liver without alcohol consumption. NAFLD is becoming increasingly common in individuals who are overweight or have poor eating habits. Omega-3 has been shown to reduce fat buildup in the liver and improve insulin sensitivity, which is crucial for managing fat and energy metabolism. By improving insulin sensitivity, omega-3 helps reduce the risk of NAFLD progressing to more severe stages. For individuals with chronic hepatitis B or C, omega-3 also has a positive impact. Not only does it reduce inflammation, but it also supports liver function and helps prevent liver fibrosis, a severe consequence of chronic viral hepatitis. Therefore, omega-3 becomes an invaluable ally in protecting the liver and managing chronic liver conditions effectively. When considering omega-3 supplementation, it is important to determine the correct dosage to maximize its benefits. According to the National Institutes of Health, NIH, adults should consume between 250 to 500 milligrams of EPA and DHA daily to maintain overall health, including liver health. However, excessive omega-3 intake does not provide additional benefits as many people mistakenly believe. The NIH suggests an upper safe limit of 5,000 milligrams per day, which includes EPA, DHA, and ALA from plant sources. Going beyond this amount could lead to side effects such as bleeding or digestive issues. For those taking omega-3 for liver health, starting with a daily dose of 1,000 to 2,000 milligrams is advisable, while monitoring the body's response. Those with liver diseases or on other medications should consult a healthcare provider before adding omega-3 supplements to avoid any potential risks. Not everyone needs to take high doses of omega-3, but certain groups of people can particularly benefit from this nutrient. Individuals with non-alcoholic fatty liver disease, NEFLD, can benefit from omega-3 as it helps reduce fat accumulation in the liver and improves the condition. Those with chronic hepatitis also stand to gain from omega-3's anti-inflammatory effects, which help manage liver inflammation and prevent further liver damage. Additionally, individuals with diets low in omega-3, particularly those who don't consume fatty fish or omega-3 rich foods, should consider supplementation to protect their liver health effectively. So, is omega-3 good for the liver? It depends on an individual's health status and needs. However, it is clear that omega-3 is an essential nutrient worth paying attention to for liver care. To ensure maximum benefit, omega-3 should ideally be obtained from natural food sources. Some of the best sources of omega-3 include fatty fish such as salmon, mackerel, sardines, and herring, as well as certain green vegetables and nuts like flax seeds, chia seeds, broccoli, and walnuts. Omega-3 is also abundant in algae and seaweed, making them excellent additions to a diet focused on liver health. For those who struggle to meet their omega-3 requirements through food alone, omega-3 supplements are a viable option. Recommended dosages typically range from 1,000 to 3,000 milligrams of EPA and DHA daily, depending on individual health needs. When choosing supplements, It's essential to select products derived from deep-sea fish, ensuring they are pure and free from harmful levels of heavy metals. While omega-3 provides numerous benefits, there are some considerations to keep in mind when supplementing. It is important not to exceed the recommended dosage, as excessive intake can lead to side effects like blood thinning or digestive disturbances. Individuals taking blood-thinning medications should consult their doctor before supplementing with omega-3. It is also preferable to source omega-3 from natural food sources instead of relying solely on supplements. A balanced diet that includes omega-3-rich foods, combined with a healthy lifestyle that limits added sugars and saturated fats, can enhance the protective effects on the liver. Some mild side effects like indigestion or diarrhea may occur, and individuals with a history of depression should be cautious, as omega-3 may cause sleep disturbances or anxiety in some cases. In conclusion, omega-3 offers significant benefits, particularly for individuals dealing with liver issues. However, to maximize its effects, it's important to supplement wisely, ideally through food sources, and to use supplements in moderation. If you have existing liver conditions or are taking medication, it's crucial to consult a healthcare professional before adding omega-3 to your regimen to ensure safety and effectiveness. This article aims to provide a clearer understanding of omega-3's role in liver health and how to use it appropriately for better liver care.